Did you know that malaria is killing thousands of people in Africa today? With renewed attention to plague awareness, we can increase the control on this epidemic. The mass of the infected are caused by malarial-infested mosquito bite. The only host for these parasites is humans. Parasites enter the bloodstream where it travels to the liver, out and multiplies, and then back into our bloodstream. Human financial resources devoted to malarial control are poorly inadequate. Late presentation, unproductive management, and unavailability to effective treatments lead to a high fatality rate in Africa. There are a few simple ways to identify and prevent the spread of malaria in Africa. Those who are at a higher risk. Common symptoms of malaria are also commonly mistaken as the flu: cold shakes, fever, diarrhea, nausea. Take a measure to prevent being bitten. Control methods to prevent larva growth. Moving on, first let's talk about those who are impacted greatly by this disease. Bringing awareness to what the impact of malaria can have on individuals. Those that are at higher risk of transmitting the disease fall in two different categories. In 2003, an article states that a pregnant woman are more vulnerable as pregnancy reduces a woman's immunity to malaria. Children under the age of 5 have not yet developed the sufficient immunities to fight off malaria. The effects of surviving malaria can be lifelong suffering. Children can develop anemias, which cause poor growth and development. The unborn of a pregnant woman may face very low birth rates. Malaria hampers children's schooling and social development. Now that you know who's at risk, let's talk about what to look at if infected. In this article for the CDC, Thomas Nishinda noted that the symptoms may develop as soon as 7 days or may progress as long as 3 months from being bit. The initial symptoms are those of the common flu, as said earlier. High fever may subside for a few hours before returning again. Headaches, fatigue, delirium, shaking, and other common symptoms if infected. Relapsing attacks can lead to lifelong complications, including bronchitis, pneumonia, seizures, paralysis, and a comatose state. Attacks can occur for years if malaria is not diagnosed and treated early. Now that you know some of the symptoms, let's talk about what preventions can be taken. For optimal prevention, protection from mosquito bites is essential. Since mosquitoes mainly bite at twilight and at night, most precautions should be taken at these times. In an article on malaria in Africa, emerging prevention and control gauze and strategies, Robert says to sleep in rooms that are properly screened with gauze over the windows and doors. Spray insecticide before entering to kill any mosquitoes that have gotten inside during the daylight hours. Mosquito net may be placed around your bed that is sprayed with insecticide. Also, wearing long pants and shirts at the twilight hours with long socks that are thick enough to resist mosquito bites increase your chances of not being bitten. Wearing insect repellent directly on the skin is also the most common way of prevention we all know. Prevention and treatment costs put a burden on the poor in Africa. Malaria-stricken families can spend on average 1/4 of their income on a treatment and prevention of malaria. Afflicted families on average can only harvest 40% of their crops harvested by the healthy families. In epidemic areas, 60% of children's schooling may be impaired as a result of being absent. Now that you know a little bit about what's at risk, symptoms, and prevention, let's talk about the best way to reduce the spread of malaria. Controlling the environment is the best way to eliminate the spread of malaria. Some of the environments include warm temperatures and large rainfall amounts that contribute to the spread of malaria. John Brennan and Amy Mills, authors of the 2000 book, The Intolerable Burden of Malaria 2, say by treating the water with bacterial insecticides can eliminate mosquito larvae breeding. Draining mosquito breeding grounds with stagnant pools of water so it doesn't sit for seven or more days can also reduce the risk of mosquito breeding. Or even a drastic measure of relocating family settlements away from the larva-infested waters can be taken. There is currently no vaccine that will prevent the dangerous strains of malaria, but there is an active field of research for it. In conclusion, as we have learned today, there are mosquitoes that need our blood to spread their disease. In conclusion, though, one mosquito bite can unleash devastation on Africa. The four things we discussed today can all be helped bring awareness, prevention, and diagnosis for malaria. Recognizing those who are at a higher risk of disease and transmission can help prevent more people of the same age and of the same risk to become open to those diseases, transmissions. Recognizing the initial symptoms to enable a quicker treatment. Recognizing that what measures can be taken to prevent killing, to prevent being bitten. Recognizing that eliminating standing water will also eliminate their larvae. If we make an active effort, we can all make a difference and bring prevention to those who suffer from malaria in Africa for good. As a nation, the greatest resource mankind has is compassion and a love for all. One person can't do this alone. Together we need to urge our government officials to stand up and send aid to those needed to save lives.